If you are over 60 years old, this video could truly change the way you view your health. Prostate issues are becoming increasingly common in older men, yet many do not realize that everyday habits are quietly making the condition worse. If you frequently need to urinate, find it difficult to start or stop the urine flow, or even have to wake up multiple times at night to use the bathroom, it is very likely that your prostate is gradually enlarging without you noticing. However, the truth is that it is not always caused by age, but mostly the result of daily lifestyle habits. As a doctor, I have seen many men in their 60s, 70s, and even 80s stay healthy and unaffected by making a few simple habit changes. On the other hand, some suffer discomfort and inconvenience because they ignore these important warning signs. In this video, I will share with you 10 everyday habits that quietly cause prostate enlargement, including one particularly dangerous habit you need to know immediately. The goal is not to make you worried, but to equip you with the knowledge and tools necessary to protect your health naturally and safely. Watch the entire video to understand how to effectively prevent and manage prostate conditions, and don't forget to share it with your loved ones. Let's explore 10 habits that may be negatively affecting your prostate that you never knew about. Habit 10. Sitting for hours without moving. You may really love your comfortable armchair, but sitting too long can affect something you rarely think about: your prostate health. When you sit continuously, especially without standing up to take breaks, your pelvic area experiences prolonged pressure. This pressure reduces blood flow to the lower part of your body, including the prostate. Over time, this poor circulation can lead to inflammation and contribute to the gradual enlargement of the prostate. For older adults, whether sitting to watch TV, work at the office, or read, staying in the same position for too long increases the risk of urinary and prostate problems. This doesn't mean you have to give up resting, but you should combine it with regular movement and avoid sitting still for too long. The pelvic floor muscles also weaken with little activity, making it harder to fully empty the bladder, causing urine to remain and further irritate the prostate. A simple habit like standing up every 30 minutes and taking a gentle 1-2 minute walk can significantly reduce this risk. Stretching, walking around the house, or taking a few steps back and forth all help improve blood circulation and relieve pressure on the pelvic area. Don't let a sedentary lifestyle quietly cause major health issues later on. A little movement today will help keep your prostate healthy, functioning well, and comfortably peaceful for the long term. Habit 9. Eat too much red meat. Red meat may be a familiar dish in your daily menu, but consuming too much red meat quietly contributes to prostate enlargement. Many studies have shown that a large amount of red meat, especially processed meats like bacon, sausages, or sliced deli meats, is closely linked to inflammation in the body, including prostatitis. The main cause comes from saturated fats and chemicals used during meat processing, which disrupt hormone balance and increase oxidative stress factors that stimulate prostate inflammation. Especially in older adults, slower digestion makes red meat harder to digest, leading to excess fat accumulation and increasing pressure on the pelvic area. You don't need to give up red meat entirely, but simply reducing your intake to 1 or 2 times per week can make a noticeable difference. Instead, prioritize healthier protein sources like fish, legumes, or grilled chicken. At the same time, try adding fiber-rich plant-based dishes such as lentil stew or vegetable soup to improve prostate health and boost digestion. Your body will feel lighter, symptoms will lessen, energy will increase, and your prostate will be protected in the long run. You don't need to give up your favorite foods, just learn to balance your meals more wisely, and your prostate will clearly feel the positive change. Habit 8. Eat spicy and processed foods every day. Many older adults enjoy flavorful, spicy foods, but few realize that spicy dishes and processed foods can quietly irritate and damage your prostate. Spices like chili, black pepper, or hot sauces can increase inflammatory responses in the body, including in the prostate. An occasional spicy meal is harmless, but frequent consumption, especially if your prostate already shows signs of enlargement, can worsen irritation. Meanwhile, processed foods contain many preservatives, artificial flavorings, sodium, and unhealthy fats, silent enemies that negatively affect health. High salt intake causes the body to retain more water, putting extra pressure on the urinary system. Foods like potato chips, canned meat, frozen meals, or fast food also disrupt hormone balance, particularly testosterone, a hormone important for prostate health. Over time, these unhealthy eating habits lead to chronic inflammation, weight gain, and hormone imbalance all risk factors for prostate enlargement. If you often choose packaged foods over fresh options, your prostate may be suffering negative effects. Prioritize natural anti-inflammatory foods such as leafy greens, berries, and healthy fats. A good diet doesn't have to be boring, it's most important to protect your health, especially your prostate health. Habit 7. Drink too much caffeine. Many older adults like to start their day with a delicious cup of coffee or enjoy a cup of tea in the afternoon, but consuming too much caffeine throughout the day can quietly irritate your prostate and bladder. Caffeine is a diuretic, meaning it stimulates the bladder to produce more urine and causes the bladder to work continuously. Additionally, caffeine makes the muscles around the bladder contract more frequently, causing a sudden urge to urinate, and sometimes even leading to urine leakage. For those with a sensitive or enlarged prostate, this pressure becomes even more severe. Moreover, caffeine causes the muscles at the bladder neck to contract, making it difficult to fully empty the bladder, leading to urine retention and increased pressure on the prostate. The result is increased inflammation, more frequent urination, and greater discomfort. One small cup of coffee occasionally may not cause problems, but drinking multiple cups of coffee, strong black tea, or energy drinks throughout the day can quickly build up these effects. The key is moderation. You might try switching to decaffeinated coffee or herbal tea after your first cup of the day, while observing whether your symptoms improve. These small changes can help relax your prostate and reduce its burden. This doesn't mean you have to give up your favorite habits. It's about finding a balance between enjoyment and protecting your health, bringing lasting comfort to your body. Habit 6. Smoking or secondhand smoke exposure. Smoking is one of the most harmful habits for your prostate, and even passive exposure to cigarette smoke causes significant damage. The toxic chemicals in tobacco reduce blood flow, trigger inflammation, and damage sensitive tissues, including prostate tissue. Smoking also increases oxidative stress, which is a cause of the body losing its ability to repair damage. Over time, this can lead to prostatitis, enlargement, and even increase the risk of prostate cancer. In older adults, damage accumulates faster, and the longer the exposure to smoke, the more severe the impact on the prostate. Moreover, smoking reduces the level of important antioxidants in the body, weakening the natural immune system and raising the risk of prostate problems. Even if you quit smoking long ago, frequent exposure to secondhand smoke can still have negative effects. If you are still smoking, seek medical help to quit safely using methods like nicotine replacement therapy or natural therapies. The benefits of quitting appear almost immediately. Improved circulation, reduced inflammation, and the prostate begins to heal. If you have never smoked, firmly avoid cigarette smoke to protect your prostate health in the long run. This decision can help you enjoy many more healthy years and reduce uncomfortable urinary symptoms. It is never too late to protect your body. Habit 5. Holding urine for too long. Everyone has held in their urine because they were busy or too far from a restroom. But if this habit happens frequently, it can silently harm your prostate. When you hold urine too long, the bladder stretches and is under great pressure. This pressure presses on the prostate located just below the bladder, leading to irritation and inflammation of the prostate tissue over time. Older adults are especially vulnerable because the muscles controlling the bladder and prostate weaken with age. Holding urine for too long can also cause incomplete emptying, leaving urine to stagnate in the bladder, an ideal environment for bacteria to grow and cause infection. This inflammation further stimulates the prostate, which may enlarge, causing discomfort that affects your sleep and mood. To protect your prostate, listen to your body's signals and don't delay going to the bathroom, especially if you want deep sleep and fewer urges at night. A simple habit like urinating as soon as you feel the need helps reduce long-term problems. Remember, the bladder and prostate work as a team. When one part is under pressure, the other is inevitably affected. Don't ignore your body's natural calls. This is one of the most effective ways to protect yourself. Habit 4. Ignore thirst and let your body become dehydrated. You may not have noticed, but not drinking enough water silently affects the health of your prostate. Older adults often try to limit their water intake to avoid frequent bathroom trips, especially at night. However, this habit causes urine to become more concentrated, which can irritate the bladder and prostate over time. The prostate is located just below the bladder, so when the bladder is under stress, it also puts pressure on the prostate. Prolonged dehydration leads to inflammation, known of the main causes of prostate enlargement. Additionally, many older people take diuretics or dehydrating medications. Without enough water intake, this condition becomes even more serious. A dehydrated body also struggles to eliminate toxins, adding further pressure on the urinary system. Over a long time, these damages contribute to prostate enlargement and cause troublesome urinary problems. A simple way to prevent this is to maintain a habit of drinking water regularly throughout the day, in small sips, even when you don't feel thirsty. The goal is to keep your urine clear or light yellow, a sign that your body is well hydrated. Staying well hydrated helps the bladder relax, reduces pressure on the prostate, and prevents unnecessary inflammation. Don't avoid water out of fear of frequent urination. Think of it as a natural shield protecting your prostate health in the future. Habit 3. Carrying too much belly fat. As age increases, excess fat accumulating around the abdominal area not only affects appearance but also serves as an important warning signal about prostate health. This layer of fat produces substances that cause widespread inflammation throughout the body, including the prostate. This mild chronic inflammation stimulates the prostate to overwork, contributing to prostate enlargement and increasing the risk of urinary problems. People with large waistlines are more likely to suffer from prostate enlargement, frequent nighttime urination, and even difficulties with erectile function. Abdominal fat also disrupts hormonal balance, especially testosterone and estrogen, key hormones that directly affect the size of the prostate. The solution is not extreme dieting but gradual and sustainable changes. Regular daily walking, reducing portion sizes, and limiting sugar intake will effectively reduce belly fat. Losing just a few pounds can bring noticeable improvements in urinary symptoms. At the same time, belly fat puts pressure on the bladder and pelvic organs, causing additional stress on the prostate. Achieving a healthy waistline, usually under 40 inches, is an important step to protect long-term prostate health. Do not underestimate the weight around your waist, because it is not simply excess fat but also a sign that your body is under stress. Reduce belly fat to feel lightness not only in your clothing but also in your prostate. Habit 2. Skip regular health checkups. Many men often only visit a doctor when they clearly feel something is wrong, but this approach carries significant risks, especially after age 60. The prostate can silently enlarge without causing obvious symptoms at first. Regular health checkups are the key to early detection of abnormal signs before they become serious. A simple examination can detect inflammation, infection, or tumors even before pain appears. For example, a digital rectal exam and PSA test are non-invasive, quick, and effective methods that can even save your life. Ignoring regular checkups means losing the chance for early intervention. Many people feel embarrassed to talk about urinary issues or worry about prostate health, but the sooner you discuss it, the more options you have to manage and treat it naturally. Delaying examinations can cause minor problems to worsen into serious issues like urinary retention or prostate infection. See your doctor at least once a year to discuss prostate health. This is not only a way to gain peace of mind but also an effective preventive tool. When detected early, often lifestyle changes alone are enough without the need for medication or surgery. Don't wait until symptoms become uncomfortable to take action. Proactively caring for your health is a smart habit every man over 60 should adopt, especially when it comes to the prostate. Before finishing, I want to share a useful tool. Many elderly people have started using a health tracking app designed specifically for seniors. This smart mobile app helps record daily symptoms, water intake, bathroom habits, and reminds you of doctor appointments. Why is this important? Because doctors can only help you best when they have continuous and accurate data. Currently, very few apps are designed specifically for men over 60, and this app fills that gap. The app is free to try and guides you day by day. You can find the link in the video description. Don't miss the chance to own a tool that supports your prostate health naturally and effectively. Habit 1. Uncontrollable chronic stress. This is a habit that many older adults often overlook, yet it is one of the most dangerous factors affecting the prostate. Chronic stress quietly triggers inflammation in the prostate. When you constantly feel anxious, tense, or restless, your body produces cortisol, the stress hormone. Over time, this hormone causes inflammation, muscle spasms, and disrupts hormonal balance, directly impacting prostate health. Stress also tightens the pelvic muscles, hinders blood circulation, and stimulates the nerves around the prostate. At the same time, it weakens the immune system, making it harder for the body to fight inflammation and infection. Many older adults carry pressures from finances, family, health, and more, causing stress to build up over time, leading to symptoms like frequent urination, pain or burning, urgency, and prostate enlargement. The good news is that you can completely manage this stress. Simple habits like daily deep breathing, gentle exercise, stretching, or spending 10 minutes in quiet relaxation can significantly reduce stress levels. Laughter, social connection, and sufficient sleep are also precious medicines for your mental well-being and prostate health. Managing stress not only helps you feel more relaxed but also heals your body from within. This small change can reduce uncomfortable symptoms and naturally prevent abnormal prostate growth. This is the most important step you can start today to live healthier, calmer, and more comfortably every day. Now that you know the top 10 habits that silently cause prostate enlargement, the important question is, what will you do next? These are not just small, isolated changes, but powerful steps that help you avoid uncomfortable days, sleepless nights, and unnecessary medication. If you are over 60, the time to act is now. Don't wait until symptoms become severe to worry. Start by changing just one habit this week. Drink more water, walk a few extra steps, or say no to that piece of bacon. Every small action carries great meaning. Your prostate won't heal instantly, but with the right habits and persistence, your body can truly work wonders. Thank you for watching. If this video is helpful, please share it with friends, brothers, or anyone over 60 who needs this information. You are not alone on the health journey, and with the right knowledge, you are never too old to start healing. Take care of your prostate today so it can always support and protect you in the years ahead.